Okay. Good morning, Sean. Dr. Parsa, thank you for joining us here again. For everybody out there, I'm Jay Remley on the board at the Lupus Foundation, and it's hard to believe it's been 2 weeks since we were last here with office hours with Dr. Parsa, and it's great to be back. Great to see you again, and hopefully everyone out there is staying safe and healthy. I know, especially for those in Northern California, the air quality and so forth has been once again, challenging, and so make sure we're taking care of yourself, staying indoors as much as possible. Just looking at purple air, out there, it's most of the areas are in the 150 plus range, which is for sure the unhealthy range. So stay indoors as much as you can to get your, exercise and stay healthy as much as you can here, especially the next few days. And so 2 weeks ago, just to recap, we talked about the main topic coming from our Lupus, Foundation members was around, what to do to stay, healthy and keep your immune system healthy, especially during these times when we do have to stay indoors quite a bit. And so we talked about making sure we get enough fluids, especially water, particularly even alkaline water. Just add a little bit, a half a teaspoon of baking soda to 8 ounces of water, or a little bit of lemon to keep your pH levels up. We also talked about sleep, and never let sleep get in the way of anything. You'd never make that up. Sleep deprivation is not something you can just make up on the weekends. So making sure you're getting 7-8 hours of sleep. And then of course we talked a little bit about exercise and really just counting your steps even and staying active. One of the things I've started to do that I shared was just having a stand-up desk, and especially if you're working from home and sitting at a desk all day at home, having a way of just getting up and maybe even standing in these nice little, desks that you can pop up on the tabletops. And then we talked also about, the vitamin C and D and making sure you keep your levels up of vitamin C and D, which are two big ones for our immune system and to keep our immune system, strong. And one of the questions, that came in, last time is rather than, taking supplements, what are some, foods that can boost your immune system? And we just take a couple minutes, chat about that as a follow-up to our last, conversation and questions that came in. But then the main topic for today is the different types of lupus. So Dr. Parsa will share his thoughts with us, the different types of lupus, what to look for, and how they're diagnosed. And that's our main topic for today's office hours with, Dr. Parsa. So with that, Dr. Parsa, I know we talked, vitamin C was a big one last time, just on this question that came in, a couple different flavors of it from last time. What are some foods or ways that individuals can, maintain and boost their vitamin C, vitamin D, foods that help their immune system? What are some natural ways of doing that through diet versus supplements?
Good morning, Jay, and good morning, everyone. Thank you for a very brief, introduction of, our previous session. So let's just get to the food that we know that's going to be helping for the immune system for everyone, especially with the patients with the autoimmune disease. So number one thing we have to make sure, since, starting with the vitamin D, which is my favorite subject, since we know that a large number of the people, we don't know the exact numbers. One of the studies from Stanford was talking about the 40%, but I believe it's just the tip of the iceberg. The number of the vitamin D deficient patients in the community is much higher than the 40%. But whatever it is, the exact number, the number one thing, it needs to be checked to know what numbers we are at. And it's very difficult to just get to the desired number, the optimal number that we wanted to, just by taking food. So I would highly recommend this, discuss that subject with your primary physician or your rheumatologist or whoever you are in contact with, to just bring the vitamin D above the 50. The good number is 65, and in that number, once we get in that number, then the maintenance is not that difficult. Then we can just take, a lot of good food, which has the good source of the vitamin D, including, sunflower, seeds, including, good oils, olive oil, and there are a lot of foods that having it. I want to discuss about, some of the food that has some anti-inflammation qualities. I would start with the turmeric. Turmeric, has some chemical inside ingredient And that ingredient is helping with a lot of condition in the body, including the generalized inflammation, and bringing the inflammation down in a natural way, independent on the other medication that we have. So we know a lot of pathways, a lot of biochemical things happening in our body, and each medication that we're coming up and coming to the market, it would approach that pathways from a different angle. So turmeric is one of the great one among the natural food that we have, which that has its own, pathway to just, suppressing and modulating the immune system. You remember that we talked about the modulation. Modulation means that the immune system is not being compromised, but not being just working in a wrong place and wrong time. Basically, just being efficient just for the bacteria or any germs that is attacking our body and not our own cells. There's a list of the great food, which I will recommend all of our audiences to just include it in their daily food. I'll go one by one. One is garlic. Garlic is a great, food with a lot of things and good things for killing a lot of bacterial overgrowth in the system. It kills a lot of the viral diseases. And also the second one would be broccoli. We know about the broccoli has anti-cancer property. Studies showed that the people are taking more broccoli, they're just less prone to have colon cancer. Pepper, especially the red pepper, spinach, and almond, ginger. We talked about the green tea, papaya, and I would highly also recommend on the seafoods. Seafoods are really good because they're the great source of the vitamin D. Again, we talked about, all of this food. Make sure that if you have any sources that you can get it from any farm, or you can just try to get it, organic, that would be the best way of, providing all of these food, and make sure that you have the balanced diet. When you're getting sick, sometimes it's difficult to just make sure that you're taking at least 1,000 milligram of the vitamin C or the vitamin D and zinc. So I will recommend during the acute course, anytime you get sick or just dealing with any infection in the body, try to just, supplement yourself with all these medication, because again, it's going to be difficult because I don't know, some people has less appetite. Some people might not be eating, that much. Some people might have some food allergy among all these great food that I mentioned. So during the acute phase or acute time that you're dealing with, like a common cold, God forbid, COVID or anything like that, make sure just you take the supplemental vitamins of the D 5,000, C 1,000, and the zinc 25 milligram. But during the day, I think that's not a bad idea to just make sure that, among all of these food that I just mentioned, to include it in your daily nutritional intake. And again, make sure that alternating, and also make sure all the sources are organic, and drink, plenty of water daily. And I think that would be the great things about the food. What we're putting in our body is going to get into our cells and affecting our immune system. And immune system is related to the general health. And the general health is related to the immune system. The mind and the immune system are just very closely connected. So anytime that mind is at ease, like meditation, when you're at the ease of mind for whatever reason that you are, your immune system is also following your mind, and vice versa. And when the immune system is not very happy, the mind is not going to be very happy. But we don't have direct control over our immune system, but we have direct control over our mind. So make sure that, you're controlling over the mind and, bad and negative, thought. Make sure that, we talked about this sleep. But that is right. So for the vitamins, I will recommend, if we're not close to the optimal number, just ask your primary physician to help you to just get your vitamin D close to the optimal level, which we already talked is 65 and above. So once you get to that one, then for the maintenance of the vitamin, you can just, find a good source of the vitamin D among all these food that I just mentioned. You can make sure they're all organic and taking it. And then not a bad idea to once or twice a month go with the 50,000 of the vitamin D, because sometimes the problem with the vitamin D is if you're not taking certain amount of the vitamin D, it would drops right away. Right away means in a matter of 2-3 months, if you're not taking enough the vitamin D, there's a chance that the vitamin D go back to the low normal. So make sure that you're taking it, and not a bad idea, once a month, twice a month, talk to your doctor to just give you the 50,000 of the vitamin D to make sure that you're not becoming behind, and keep that optimized level constantly.
That's great. Well, thanks, Dr. Parsa. Yeah, it's I remember that Stanford study not too long ago. It's amazing that nearly half of Americans have vitamin D deficiency, and especially for lupus patients who aren't supposed to be in the sun. There's not really a good way to also even boost your vitamin D a little bit through getting out there in the sun for prolonged periods of time. That's not good. So getting that vitamin D through boosts, through supplements, vitamin D 5,000 a day, or obviously, through diet. So that's good to know. So 65 and above on your blood work, if your vitamin D is at 65 and above, it's easier to maintain, through diet and what you've mentioned there. So on the vitamin C side, just real quick, it was interesting. I didn't realize red bell peppers, have 3 times the, roughly 3 times the vitamin C of a, orange from Florida or California or wherever it may be. Oftentimes people think oranges are, obviously are high in vitamin C, but even certain vegetables, right, are very high in vitamin C too. So that's
so pepper has also some anti-inflammation properties, which is I would highly recommend. Indian people knew about this. Black pepper has the active ingredient by the name of capsaicin, which is the anti-inflammatory things. And second thing is the turmeric that they're using. If you go to the eastern part of the world, you see that a lot of these spices is for their cooking on a daily basis. And some of the diseases is much less in that area, especially autoimmune disease. Besides the genetics, might be, taking all of these great, spices could be the major factor not letting the immune system working improperly.
Weaken. Yeah, exactly. No, that's great. Hey, also just for our audience here, remember you can ask questions here live to us through our Facebook page, or if you'd like to keep it more private, you can go the other side. You can email us at communications@lfnc.org. Also, you can monitor our lfnc.org COVID-19 page, and we'll continue to put updates there around a lot of the topics we're talking about here with Office Hours with Dr. Parsa. So let's shift gears. So the last 2 weeks ago, and as well as here today, we talked more about wellness and diet and what you can do to keep your immune system strong. The one thing we haven't talked a lot about, especially with COVID and everything, getting back to lupus, we've had questions that have come in through our community and members asking what are the different types of lupus. And then what are the ways that the medical community and patients are diagnosed, with either one of those? So, the main lupus that most people hears about is SLE, or systemic lupus. And then you've got discoid lupus, right, which is mostly the skin, whereas systemic lupus really impacts, your major organs. And it is the most, commonly diagnosed and the biggest one out there. But would love to get your thoughts. There's different, variations of each of those 2 main types of lupus, but Dr. Parsa, would love to get your thoughts. So what are the, from your experience and what you've seen with lupus patients, what are the types of lupus out there, and how are they, most commonly diagnosed?
Sure. As you know, the systemic lupus is a disease that can affect any organs, including the skin. And actually, the large number of the patients just have some photosensitivity that when they're going to the sunlight, they're just, their skin just burns and, reacting to it. Also, they have the malar rash, which is the butterfly, feature of the erythema, or the redness over their facial skin. So we have 2 different entity in medicine. One is the SLE and the other one is the DLE, that they're not necessarily related to each other. So I'll just go with the patient that either suspicious to have the SLE or being confirmed to have the lupus. Lupus itself could, again, as we talked, could manifest with the different ways of the skin manifestation, different rashes, It could be also some of the lesions inside the mucosal membrane, in the mouth, in the nose, in the rectal area, in the genital area. They can have all of those. The differentiation between the SLE, is it the SLE or is it the lupus, and the manifestation of the lupus that manifests itself as this rash, or is it a different entity that we call it DLE, or some other diseases that resembles to the the lupus, but it's not lupus. It's a very technical and very challenging sometimes area of the medicine, that sometimes the characteristic of the lesion and also the biopsy eventually, sometimes it's very difficult to know, is it the lupus that has the manifestation, or we are dealing with a different disease. Sometimes it's very difficult by the characteristic, because a lot of these rash has a lot of common manifestation on their presentation. So the biopsy would be something that is giving us the definite answer to how to treat it. I don't want to go through the technical part, but the systemic lupus, or the lupus, is having a lot of manifestation of the skin, and all of those. So if you're having any rashes that you didn't have it at the beginning of your diagnosis, or you have some rashes that you might think that you have the lupus, make sure that contact your primary physician. Again, the differentiation of all these lesions, it's a little bit outside the context of the area that we're talking here in our webinar, but just know lupus itself could manifest itself with a different type of rash, or it could be a different type of disease that we call it discoid lupus erythematosus, which has some similarity with the lupus, but is not lupus, has some common things, with the lupus. And the differentiation between these two is very difficult for the patient to know, do I have the DLE or I have SLE manifestation? I would highly recommend talk to your doctor, let them to take a look at those rashes. And sometimes even for the physician and the rheumatologist, it's very difficult to know what type of, is it the lupus, or are we dealing with the discoid lupus, which biopsy is going to be very helpful. Of course, some of the characteristic would just make the diagnosis in the favor of the DLE versus the SLE. That would be, again, it's a lot of details. I'm sure that, we don't need it on this webinar. And what I would recommend, anytime you're dealing with the new rash, make sure to talk to your doctor, and they would guide you to see, is it the lupus flare, or is it the manifestation of the lupus, or we're dealing with the cousin of the lupus, which is a DLE, which is not affecting any internal organ, just this type of a disease that affecting just the skin. It could be on the scalp. It could cause the hair loss, like in the patchy area. Could be some redness over there, the face or other part of the body. And generally speaking, the biopsy usually is that give us the last word. Would say, is it the DLE or is it the SLE? So.
Great. Well, thanks, Dr. Parsa. Yeah, I will say that it's commonly known as the butterfly rash, where it almost looks like a butterfly commonly, across the face, the nose, and so forth. And yeah, and in diagnosing lupus is complicated. It's one of the most complicated autoimmune diseases to diagnose, and it manifests itself often through many other illnesses where it is misdiagnosed. My wife had lupus actually when she was 13 and didn't officially get diagnosed until she was 23. So it took almost 10 years, to diagnose her with lupus. Fortunately, we've gotten a lot better in the last, 20 plus years as far as our ability to diagnose lupus. There's been a lot of research and a lot of knowledge just out into the medical community. And as far as physicians, learning more about lupus and bringing it to the forefront. And it's a big part of what the Lupus Foundation does, is driving awareness and education, both in the patient community as well as the medical community, around making sure physicians know what lupus is and how to more quickly and effectively diagnose it. But it is very difficult to diagnose and is commonly misdiagnosed. So that's great. Thank you for sharing, your thoughts on that. We did have a couple questions come through, Dr. Parsa, that I wanted to ask you here. We have one question came through here. Our Facebook Live is, what can we do if affected by coronavirus? Are there any kind of prohibited medications? So it sounds like, are there any medications that lupus patients should try to avoid during the coronavirus, or maybe even if they have, COVID, if they are diagnosed with COVID, are there any medications they should try to avoid?
What not to taking. So general rule for the lupus, outside the subject of the COVID is we have to make sure, and your physician needs to be make sure giving the medicine, because there is another entity, we call it drug-induced lupus, which is a different disease, different than the SLE or DLE, and like a very famous, medication by the name of hydralazine, which is a blood pressure medication. We know in some subsets of the patients, by taking the hydralazine, they would start having some of the manifestation of the lupus. The good thing is, once we know it's because of the hydralazine, by stopping the medication, all the symptom would go away. There's some other medication also can just causing the drug-induced lupus, which again, this is a different disease, not the SLE, not the lupus, but there are a lot of common manifestation of the lupus. So that's number one, as a general rule for the patients with the lupus, to make sure that anytime that you're taking anything, discuss it with the doctor, even though over the counter, or you can search it on the Google to make sure this is not among any of the medicine that could cause drug-induced lupus. But generally speaking, for the people when contracting the COVID and the COVID virus, one of the things that is still questionable, we don't know much study about it, is using the NSAID. There's some of the study came from France that showed, some ibuprofen had negative impact on the outcome of the ibuprofen. There was another studies from other one that contradicting this. So this is a very controversial, subject. We still don't know. Again, we're still learning more and more every day by, gathering all this information and finalizing it, removing the biases among all of those. So generally speaking, if you got contracted any viral disease, including the COVID, I will recommend for controlling the pain and the fever, start with the Tylenol, and go to the max dosage of the Tylenol, which is 3 grams a day, 3,000 milligrams of the Tylenol. You can take 500 more in the morning, 500 in noon, and 500 at night, which makes it, 6 pills and 3 grams in case that, your fever is not under control. And I had a couple of patients, myself came to me or was being consulting with me that the Tylenol wasn't good enough for them. I started, NSAIDs. NSAIDs is group of medicine, we call it non-steroidal anti-inflammatory, drugs like ibuprofen, like naproxen, like Aleve, diclofenac, meloxicam, aspirin. These are the medication, we call it NSAID. And Tylenol is not an NSAID. That's why I said that you can start with the Tylenol. So you can start taking the NSAIDs, and there is one study that is being confirmed that naproxen was a good NSAID for the people with the flu, and the shortening the course and severity of the flu. So you can try the naproxen, you can try, again, ibuprofen, discuss with your primary physician. Of course, make sure all the NSAID has the potential to cause some irritation in the stomach or causing bleeding. Make sure to take it with food. And if you feel any heartburn or stomach pain, make sure you take some antacid over the counter, omeprazole. So start with the Tylenol. If Tylenol is not enough, then you can start having some NSAID. Take it with NSAID, make sure you take it with food. Make sure take some antacid, with it, like omeprazole or some of lansoprazole, these over-the-counter medicine that minimize the side effect of the NSAID. The other thing that you have to make sure, the patients who has congestive heart failure or problem with the heart or the kidney, or they have the lupus affecting their kidney, we recommend not taking any NSAIDs, because the NSAID, we know that not good for the kidney that is already been failed. And the patients over the age of the 70, 75, just be very cautious with the NSAID. Again, NSAIDs are aspirin, Aleve, Advil, Motrin, naproxen, and those kind of medicine in the market, not the Tylenol. So be cautious about the heart disease, or if you have kidney disease, and make sure that if you don't have any of those and Tylenol hasn't been enough, take it with food or with the antacid medication. That would help until your pain and fever going down. And don't forget about the hydration as well.
Great. Thank you, Dr. Parsa. Actually, we have another question that came through. Could be a little bit related to that last one here around pain management. But the question is, I'm having a flare in my joints, arthritis, aches, and pain. What can I do to calm it down? It's quite painful. Any thoughts on that as far as what some remedies might be?
So the first thing first, I will recommend make sure that this patient hasn't asked that question to just get in touch with your primary physician. Sometimes it could be just the first presentation of the relapse of the lupus. So we have to make sure that it's not a lupus relapse, because if it is the lupus relapse, we have to go and start some medication. We're talking about the steroid to calm down the inflammation first, and then you eventually make sure and review all of your medication that you're taking. So the joint pain is always a red flag for me. It's very difficult to just, with this webinar that I would just go review what are the things on the favor of the flare lupus versus just, simple musculoskeletal pain or a viral disease that might, manifest itself with the musculoskeletal disease. But generally speaking, anytime that your pain in the joints is worsening along with or without any other symptom, talk to your primary physician, let him or her choose to run a couple of tests, make sure your lupus hasn't flared. If the lupus has not flared, so we're sure that you're good, then a lot of good things that you can take. Again, turmeric is one of the things I would highly recommend to take it. But depends on what type of medication you need to have and how often you get these joint pain. If it's something very common, we might consider changing the regimen of the lupus that you're taking to make sure that controlling over the joint pain and the problem in that area. And the question is it one joint? Is it all of the joint is affected? So a lot of things we have to ask to gather the information to see what exactly we are dealing with. It's not uncommon that someone with the lupus also have another disease like a gout sitting on top of the lupus. So again, anytime that you start experiencing anything new, make sure that resembling, the lupus, symptom, which is arthralgia or the pain in the joints, and arthritis, which is the inflammation of the joint, is one of the manifestation of the lupus flare. It could or could not. The lab would tell us. If it's not the flare, then we have to come up. Is it one joint? Is it all of the joints? But generally speaking, make sure that turmeric, tons of water. Make sure also some hemp and hemp oil, also very good with the the inflammation. But number one thing is make sure it's not a lupus flare. Because it might be the first manifestation of the lupus flare, which the treatment is totally different, and you have to go to the course of a treatment to just bring the flare down and go to the remission. While you're on the remission, then we can talk. So that's going to be very difficult that I can't tell you what the next best step is going to be. But if it's not the flare, then we have to see if it's one joint, is it multiple joints? Some people might have carpal tunnel syndrome on top of having the lupus, which is we have to change your work and make sure that you're using those ergonomics. If you're using with a computer and mouse, just have something that is supporting your wrist area. Give it some exercise you can do. So these are all the possibilities.
Okay, great. Thank you, Dr. Parsa. I mean, it sounds like also, from the from our audience member here is, especially during COVID, I know just with other lupus patients, even my wife, there's a heightened awareness of, is this joint pain, fatigue, are these symptoms of lupus, or am I possibly, getting COVID or have COVID? Is there any similarities in the symptoms between lupus flare and COVID-19?
A lot of similarities actually is one of the very confusing and challenging part. So for that reason, even the physician, even the rheumatologist might not be able to tell you, are you dealing with the viral disease, including COVID, or is it the lupus flare, unless we're running some lab tests, which is giving us some clear clue to see what we are dealing with. Clinically, it's difficult. Some of the thing is in the favor of knowing it's a viral disease. Like if you're starting having low-grade fever or fever, it still could be a possibility of the lupus flare, but if the previous flare never just was associated with the fever, and this time you have the fever, it's more in the favor of having the viral disease. But the final and definite answer is going to be the history, physical exam, and some lab tests, especially if it's more than one joint. We need to just, take it very serious. Anytime you have any of those symptoms, make sure to get some help. It's very difficult to self-diagnose or just go with some advices here, but the best advice is make sure to get a hold of the primary physician or your rheumatologist at the first time, and they would be able to help you and guide you to the right track.
Okay, great. Thank you, Dr. Parsa. And yeah, I know that as far as getting, COVID tested, there are various, locations around the Bay Area, Northern California, around the country. I know here in the South Bay, there's the urgent care here in Los Gatos. I think it's Care Now Urgent Care as far as, getting COVID tested. But it sounds like, for this individual here watching our Facebook Live event, one, see your primary care physician. If you don't have a primary care physician or you're having, trouble, getting a hold of one, feel free to reach out to us here at the Lupus Foundation and we can help with that as well. But probably lab work, as well as even, there's a lot of locations around where you can get the COVID test and maybe put, that side of the concern aside, right? Knowing that, okay, it's not COVID, maybe it is, my lupus, but I should still go see my primary care physician and have some lab work done, really to gain deeper insights beyond just the topical symptoms. So
exactly.
Okay, that sounds good. Let me see. Let me check one last time here. And Dr. Parsa, I know we're a little over and on time, checking to see if we have any other questions coming through live here. It looks like that was our last question. And again, we try to keep these to 30 minutes and a particular topic, but we're always open to questions for any questions that are on your mind out there in our lupus community and members of our Lupus Foundation. So once again, Dr. Parsa, thank you so much for joining us and supporting, our patients, our community, and the Lupus Foundation. As always, it's great to do these every other Saturday with you, and look forward to seeing you again in 2 weeks.
It was a pleasure. Thank you so much, Jay, for just, hosting me and hosting our audiences here. If there is any question, make sure that you're sending it over and we'll discuss and talk about it. Stay healthy, focused, and hopeful.
Thank you so much, Dr. Parsa. And again, for everybody out there, you can, get me the wrong way. You can always contact us, communications@lfnc.org. If you have any questions, send us any of those questions and we'll get them to the right individual and responses, back to you. So once again, thank you, Dr. Parsa, and thank you everybody for joining us. Look forward to seeing you again in 2 weeks. Bye-bye, everybody.
Thank you so much. Bye-bye.